Welcome to The Explainer. Today we're diving into something really critical, a kind of hidden saboteur that can completely derail recovery for millions of stroke survivors. You know, it's a question that has puzzled doctors for a long, long time. I mean, how is it possible you can have two people, same age, with almost identical strokes, but one recovers nearly perfectly while the other faces a lifetime of disability? What's the secret ingredient here? What explains such a huge difference? And the stakes here, they're incredibly high. Just think about this number, 6.5 million. That's how many deaths were caused by stroke in a single year, according to a major study. That makes it the second leading cause of death on the entire planet. So you can see why figuring out every single factor that affects recovery is just absolutely vital. All right, so let's get into the heart of it. It turns out the answer to this whole recovery puzzle might not be found in the stroke itself. Nope. It's in what happens when the patient is asleep. There's this culprit, a condition that impacts millions of people. And the crazy part is, it often does its work silently. Most people don't even know they have it. What we're talking about here is obstructive sleep apnea, or OSA for short. And let me be clear, this is so much more than just a bit of loud snoring. It's a really serious condition. It's when your throat muscles relax so much while you sleep that they completely block your airway. We're talking literally stopping you from breathing, sometimes for seconds, and believe it or not, sometimes for over a minute. And get this isn't some rare, obscure disorder. Not at all. A recent analysis estimates that nearly 1 billion adults around the world have some form of OSA. 1 billion. That makes it one of the most common and one of the most frequently missed conditions out there. Okay, so here's where the connection becomes impossible to ignore. Researchers found this incredible overlap. Get this, more than 80%, that's 8 out of every 10 patients, have some kind of sleep-disordered breathing right after they've had a stroke. That's just not a coincidence, right? That is a huge, flashing red flag. So with a connection that strong, researchers obviously started asking a really critical question. Could OSA be the thing that's actively sabotaging stroke recovery? Let's dig into the evidence and see how they connected the dots. And here it is. This is the bombshell finding from a major study published in 2022. What they found was that having severe OSA isn't just, another health issue on the list. No, it is an independent risk factor. That means on its own, it's a huge predictor of a poor recovery. It doesn't matter how bad the stroke was initially or other factors, this one thing is a game changer. And if you want a number to latch onto, how about this? That same study found that stroke patients with severe OSA were 3.6 times more likely to have a poor outcome. Let that sink in. Not 36% more likely, 3.6 times more likely to end up with a severe, lasting disability. That's a staggering number. This chart really puts it into perspective, doesn't it? Look at that. For patients with just mild OSA, the risk of a poor outcome is around 20%. But for those with severe OSA, that risk just skyrockets to over 70%. The difference is it's night and day. And it begs the question, what is going on here? So, what's the mechanism? I mean, how can a sleep disorder, something that happens when you're not even awake, have such a catastrophic effect on the brain's ability to heal after something as serious as a stroke? I love this analogy. It just nails it. Imagine a construction crew trying to fix a building, but every few minutes their power gets cut. That's exactly what sleep apnea does to your brain's repair crew. The core issue is something called intermittent hypoxia. Basically, the brain, which is already injured and screaming for resources to heal, is getting its oxygen supply cut off over and over again all night. And that lack of oxygen slams the brakes on neuroplasticity, which is the brain's amazing ability to rewire and fix itself. And this cycle is just brutal. It happens again and again and again. Your airway closes, you stop breathing, your oxygen levels just plummet, and then your brain basically panics. It sends out this emergency signal to jolt you awake just enough so you can gasp for air. Now, in severe cases, this can happen hundreds of times a night. Just think about that. The brain never gets a chance to enter those deep, restorative stages of sleep or all the real healing work gets done. And here's something amazing. Scientists can actually see this distress happening in the brain. They use a tool called a quantitative EEG. Think of it as a way to analyze the brain's electrical signals. And they found this very clear fingerprint. It's like a signature that shows just how badly the brain is struggling under the strain of severe OSA. So, in a healthy brain that's trying to heal, you see a nice balance of different brain waves during sleep. But what do they see in a stroke patient with severe OSA? They call it a slow wave takeover. These specific delta waves just swamp everything else, and it's a telltale sign of major brain dysfunction. It's almost like the switch for the brain's entire repair system has just been flipped to off, and it's stuck there night after night.
Okay, but this story isn't all doom and gloom. In fact, far from it, because identifying the problem this clearly, well, it also points us directly toward a really powerful solution. When you can see the saboteur this clearly, you can finally start to fight back. And that's really what makes this discovery so incredibly important. Think about it. There are so many factors in stroke recovery that are just out of our control. But obstructive sleep apnea, that is a highly treatable condition. So this research doesn't just point out a problem, it cracks open a whole new door for how we can help. The main treatment for this is called CPAP. That stands for continuous positive airway pressure, and the effects can be just profound. Studies show that using a CPAP machine does way more than just stop the choking episodes at night. For stroke patients, it can help get blood pressure back to normal, it can reduce these dangerous swings in arterial pressure, and this is the big one, it can potentially improve both their thinking and their overall chance of a good recovery. So it's no surprise that experts and researchers are now making a very clear recommendation. This quote says it all. Screening for these sleep disorders needs to become a standard and fast part of care for every single stroke patient. Simply finding it and treating it could be one of the most powerful tools we have to change someone's life after a stroke. So it leaves us with this pretty provocative thought, doesn't it? Could the real key to healing our brains actually be hidden in the way we sleep? This research really forces us to think about sleep differently. It's not just passive rest. It is an active, critical process that is absolutely essential for healing. And for countless stroke patients, figuring out how to unlock the power of a good night's sleep, well, that might just be the key that opens the door to a much better recovery.